Yeah. So what is some of your advice for a new mom getting started with, they're not, a lot of moms, think my baby doesn't have teeth yet. I don't have to worry about the dentist.
Mhm.
But what are some things that, they should be thinking about?
I think that, I work with a lot of children with a lot of different behavioral challenges. And I think when it comes to brushing, when it comes to anything in the mouth, it's about early introduction. So the earlier you introduce it, the better. So that's why it's not like essential in terms of cleanliness for parents to be brushing or wiping the mouth before the teeth come in. But the idea is that if you take a washcloth or one of those silicone finger toothbrushes
Mm.
or a silicone brush and you have the baby just exploring with the mouth early and just getting used to the idea of someone else's finger in a very personal space that no one wants anyone in. But if you get that habit going early, it could be after like a nursing session, after a bottle, establishing some sort of expectation and routine early. Babies are actually a
Mhm.
lot smarter than you think. When they're newborn and you start it early, they start understanding that there's this step that involves someone going into my mouth. So by the time that you're ready for brushing and you need to introduce the soft bristle toothbrush or toothpaste or whatever, at least they're already comfortable with the concept. So you're not struggling with balancing both.
Right. Yeah. Because someone not only coming at you with something in your mouth, but, a brush with this stuff on it that, yeah, that might taste different.
Mhm.
Yeah, if you've taken out one of those elements, that's true, then you're not having to battle everything.
Mhm.
So when a baby does start showing teeth, any recommendations or any helpful hints for moms as far as that is concerned?
Once babies start having teeth, you can start brushing with a soft bristle toothbrush, and you don't need much toothpaste. Some parents want to start with fluoride free. The AAPD and AAP is saying if you want to use fluoride, it's completely safe, but you want to use a rice or a smear size amount no matter what toothpaste you're using. And then you'll gently brush along the gums, you'll gently brush along the teeth. You might want to lift the lips so that way you can reach the areas that's closer to the gums.
Mhm.
And then as you're brushing, the idea is you don't want to force, you don't have to force it at the beginning when they have like one teeth or two teeth. You really only need about like 5 seconds of tooth at the beginning. Once they become more and more comfortable, then you can kind of power through and do more. Once they have a lot of teeth and they're still uncomfortable brushing, then unfortunately at that point, there does have to be kind of a dynamic where they have to do something they don't like. And once they're at
Mhm.
those toddler years, it can be extremely challenging if they're crying or if sometimes they just don't want someone else to do it, and they throw a tantrum, or maybe right before bed is when people are brushing. That's also when your child is the crankiest. So it's just a lot of challenges that when parents get discouraged with the crying, I try to encourage them. It's not the brushing itself, it's that whole dynamic you're dealing with a toddler cranky before bedtime, doing something that's not necessarily everyone's favorite. Even adults sometimes
Right.
like, ugh, I don't want to brush, I just want to go to bed, or I just want to keep watching that show. So your baby's the same, and I would treat your toddler just like, keep in mind that an adult hates flossing, an adult doesn't
Right.
love brushing. So when you're trying to make it fun for them, it doesn't happen immediately. It's about exposure, doing it every night, much like sleep training. I kind of try to equate the two. If you're trying to
That's
train
great.
your kid with brushing, it's exactly like sleep training. You want to keep the expectations realistic, but you want to be consistent at the same time and try to make it positive as possible.
Yeah, that's a great way to think of it because, as parents, we always see the charts and the, behaviors and, kind of your daily routines. And, that can come. You don't have to do everything at once.
Mhm.
It's probably a little more age appropriate to introduce, some routines like that a little bit, at least as far as doing it, at night or after dinner or whatever. But when you're when you're thinking of baby steps, or you're thinking literally of challenges your kiddo might be giving you, that you can change it up, and it's okay to do that. You're not
Yeah.
going to.
Mhm.
The more important thing is the brushing. So excellent. What about flossing? I know that's going to get a little bit older, and, when
Mm.
babies are probably more into, and toddlers are more into, solid foods, but what should that look like?
For flossing, once your baby has teeth that are touching side by side, then you can imagine those surfaces, the bristles are not going to reach so well. Or if they're touching, sometimes babies, when their teeth come in, they're not quite straight. So
Mm,
they kind of have like a little zigzag, or they're a little jaggeded. So your toothbrushes can't really reach the surfaces there as well either. That's when I start kind of coaching parents. Now is the time to really start doing it. As your baby grows older, to prevent cavities, it's going to become important. So it's really not really an age that's appropriate. It's more based on your child's development in their teeth. That being said, if your baby's teeth are touching like this, and you have all this spacing, some kids, their teeth don't touch until ages 2 or 3 in the back. And sometimes when you wait that long to introduce the concept of floss, it can be challenging. So even when their teeth aren't touching, if you feel like you have a pretty good grasp on brushing, then you can just get one of those little floss picks and supervise them and just say, hey,
mhm,
this is floss. We use it to clean our teeth as well. And now you're making your big girl, big boy transition. So let
mhm.
them play around with it. I know my daughter really likes sweet mint floss. So she just
Yes.
string and she like kind of suck on it and stuff. And we just let her play with it when she was quite young. And
Hmm.
now she actually loves flossing and hates brushing. So I think that's a
Oh, that's
big point. You think your child is not going to master flossing because they hate brushing. And that's why we
Mhm.
were hesitant to introduce it. But when we saw she really liked it, her teeth are rather crowded, we were like, oh, it doesn't hurt. So we tried it. And she actually prefers the flossing way more than the brushing.
That's
So
yeah, that usually doesn't happen.
yeah.
So the little picks are those are okay to you. I mean, I know not the ones that have, the points on the end, those, made for adults, but they do make some really good products out there for kids, especially that, are a little rounder, and, some of them even have different tastes. Like you said, the mint, and some of them are flavored other ways. So those are
Yeah.
perfectly good.
I think the floss picks are useful when kids are just getting started. If parents are having trouble with their own dexterity of how to wrap around, working in a kid's
Mhm.
mouth that's rather wiggly, doesn't want to open sometimes. So the floss picks are convenient. Like you said, when they make them for kids, the end on the other end is rounded, and they have
Mhm.
different flavors. They also have unflavored. I mean, some kids are averse to flavors, so
Mhm.
unflavored is always good. I think if parents are having trouble reaching, they also make like long handle toothbrush ones. So then the handle's a little longer. And when the handle's longer, you just have better control over it
Sure.
as well
Mhm.
for some hands. And then I also recommend, like, if you don't really want to do the floss picks, if you want something more environmentally friendly, you can also just take a loop of floss about this big, about the size of your hand, and you just
Okay.
put it together in a circle. And that way, when you're, flossing, you don't have to move the floss around. So it eliminates one step where you're kind of struggling with figuring out what to do with the string. The loop is
Mhm.
closed. So as you're flossing, you have a stabilization point when you're flossing.
That's a great idea. I wish I would have known. Yeah, I never thought about that when my kiddos were younger. So, well, but now we can pass it on
Yeah.
to someone else. Yeah. What about some of the troublesome behaviors, like thumb sucking, or even dental trauma? At the time, I think he was 3, we were at a gymnastics indoor park, and he fell on, metal bars and had trauma, ended up having to get his teeth extracted at such a young age. So I know that's kind of two different things, but maybe the trauma part first. Um, and went to the emergency room, had to go see a pediatric dental specialist to have those extracted. And, it's a very traumatic experience. And, he had to be put in in something to secure him so his arms wouldn't flail while they were, needing to do it. And,
Mhm.
they were like, Mom, you can stay. And I'm like, no, you gave me the option to leave. I'm gonna leave, and I'm gonna step away, because it was so traumatic for me. So for a child to do that, any thoughts or recommendations how parents could handle those situations? Or,
Um,
fortunately, we have specialists like you to be able to go to.
yeah. I think that, dental accidents can be really traumatizing, like you said. I mean, when the accident happens, there's a lot of crying, there's a lot of blood. It's just a whole thing, and you're alarmed because it hit something in the face, and the face is a very, it's the area we want to protect. That's where our head is, that's where our brain is. So I think when an accident happens, I tell parents, it's hard to stay calm, but you have to stay calm and have a plan. You have a plan when these things happen. And the first thing is when they fall, you want to assess for signs of concussion. You want to talk to them. You want to make sure that they're alert, that they're functioning well, because if they aren't, if they're a little bit groggy, or you think that they have a concussion, then that's first. If the teeth fall out, I want that to be very low priority. The kid concussion assessment is first. And then number two, then you can, once they're alert and you have a pretty good idea that they're doing okay, then you can kind of reassess what's happening in the mouth, have them kind of grimace or, whatever they're comfortable with after such an accident. And then I would have maybe in your first aid kit, just an emergency number ready. Or if your child is getting teeth, the AAPD now is recommending, children to find something called a dental home by age 1. And the reason we emphasize that is not only for cavity prevention, not only for, just desensitizing and getting kids comfortable at the dentist, but it's also for times like this, because most of us who are pediatric dentists have a way that there's emergency services. So in the event that an accident happens, we have a way that patients can contact us and we can triage for them. Do you need to come see us? Do you need to go to the emergency room? And we can help parents and guide them through the nature of the accident and what the best treatment option is. Maybe it's something they just need to stay home for, so we wouldn't want to bring them in, overstimulate them day of. Maybe it's something that needs to be done like with your son and more urgent, so then we would want to bring them into the office. And I think, for kitty injuries, pediatric dentists are still the best people to go to. I love general dentists. I mean, my mom and my mother-in-law and my brother-in-law are both all general dentists, and they're excellent. But pediatric dentists just work with a very specific age group. And if, it is a traumatizing experience, we want to make it as comfortable for families as possible, and we're trained to do so.
Yeah, that's great. So a dental home by the age of 1, that's a great piece of knowledge. Yeah, we had just moved to the Washington, D.C. area and, had only been there a short time and didn't have any of that, set up. So it was, that's good to know and to think of, when you're
when in doubt, the emergency room is perfect. Most emergency rooms have some sort of dental triage or facial triage kind of system in place. Especially in San Francisco. I mean, the UCSF pediatric dental program sees dental emergencies, and the residents are very well trained, very pleasant, and they respond almost immediately. So if you go to the emergency room associated with UCSF, I know for sure they have a system in place.
Right. Great. Well, and then my other question, I know that was like 2, but those bad habits, the thumb sucking, pacifiers, what are some things that parents should start doing to, wean their children off of them, or some things that they should consider?
If you notice, so kids are very interesting. There's some kids who really just don't have that need for sucking. Parents are like forcing the pacifier in the mouth and they don't want it. And then other kids are the type that just really get the comfort from the sucking. My daughter is kind of like that, she really needs something to suck on. So using the bottle, using pacifier, all those have been quite challenging for us, but every kid is different. So I think that if you recognize that you have a child that likes to suck on things or has some sort of fixation where they always have something in the mouth, then that's okay. Then if you recognize that early, then I would say by the time they're 1, it's important to establish a nice sleeping technique. Maybe they do need the pacifier, the thumb, to fall asleep, but they're falling asleep routinely. They have a nap schedule, they have some structure to their sleep. So that way, when they're using the item, you can start transitioning where they're only using that item for sleep. Once they have that routine in place, I think that if they do have that sucking need early, then it's also important to work on their emotional coping skills earlier, naming their feelings. Once they name their feelings, they can recognize them. They can start learning how to soothe with other methods. And number two, lots of kids don't like loveys once they're like 2 or 3, if they already have the object that they're using. But before age 1, you can start, if you notice your baby loves the pacifier, then why not, put them to sleep with a little blankie once they're old enough, or a little stuffed animal. So that way, by the time you take away the pacifier, they still have a comfort object. And same with the thumb. If they're trying to wean off the thumb, then you want to think about, okay, think of it from their perspective. When you take away their thumb or pacifier, is like their best friend. But if you have 2 best friends, then maybe it's a little bit easier to take away one and make the coping easier. And I also think that toddlers go through a lot of separation anxiety, stranger anxieties. So you want to build their security. You want them to feel confident and loved at home, and doing more connecting activities with your child, just like looking eye to eye, eye contact for like 10 minutes or something, or at night having a routine where maybe they sit in your lap and have a snuggle while they're reading or something like that. And I think kids who feel that kind of security, they kind of do better with the emotional weaning process. I wouldn't do it during a stressful event. I wouldn't do it, when you're on a move, changing a nanny, changing school. But at the same time, once you find that time that's right for you, I'm going to work on this thumb weaning or this pacifier weaning. The dental effects we usually recommend by like age 3 at the latest. So you have time, and then structuring it over age 2 to 3. If you come up with a plan, I would say, so you have to find that balance where you still want to stick with your plan and enforce whatever rule you've established. So in our home, my daughter is 20 months and we wanted to get her off the pacifier way earlier, but she started sucking her thumb and we just knew mentally and emotionally something was up. Physically, she's not ready. So instead we established a rule, it doesn't leave the crib, there's a way to be gentle about it, but also establish firm boundaries. So that way they're able to wean in the future and not have as many consequences on their teeth.
Yeah, that's great. We did the same thing with the pacifiers. It was just when you're in this space, this is when you have it. And it was just a matter of a real, honestly, for the most part, a simple matter of just redirection. Like, they're out of the crib and they're crawling or they're, running out of the room or whatever, but they're, just redirecting them to something else. And so they can easily forget about it and move on to something. So as we wrap up our time here, I am curious about like the dental visit. When should parents be making that first visit to come into the office? And, as the dentist mom, as you're known as, what kinds of things do you do to help for that first visit?
The AAPD is recommending by age 1. So a lot of pediatricians, I think, are still, so there's new guidelines, since 2014, the guidelines have changed because the amount of cavities was just really high. So we kind of modified the guidelines so that way we could screen kids a little bit earlier. So even the pediatricians now, some of them are helping us screen and saying by age 1. But if your pediatrician tells you something different, just know they're not actually wrong. We're just using different guideline updates. But age 1, the recommendation is that because when parents come in, there's a lot of questions. They don't really know. Oral health is kind of a tricky field to navigate, and a lot of the advice is tailored based on your child's behavior. Not really as much, there's generic advice, but then if you're looking for specific tips on how to make life easier, it's going to be based on the child. So we treat families based on their child and based on their family situation. So some families are going to be at higher risk for cavities, so they're going to need, maybe the fluoride toothpaste is going to need to be introduced earlier. Maybe there's going to need to be some modifications in diet. If mommy always has cavities and then she's sharing the spoon or spit with the baby, then we want to make sure that baby is taken care of appropriately so cavities are prevented in that baby. And at that visit, we also discuss, trauma prevention, like you said. We go over all the habits, and we kind of give a little breakdown, this is the age you're trying to target to wean this habit. So that way, if they come at age 1 and we say you need to get off the pacifier by age 3, then it's realistic. Whereas if you come by age 3 and we say you need to get off the pacifier by age 3, then you don't have much time to work at it. And also kids, at that age, they start associating any medical office with the space where they get like vaccines or shots, or where they go when they're sick or they're getting uncomfortable things done. So we want them to realize when you come to the dentist, you're cavity free. You really just brush your teeth. It's painless. It's fun. You get a prize. You leave, and you continue to be motivated brushing at home. And we want to create this positive bubble. I mean, there's a lot of old school dentists where it's like holding down the kids to do dental work and, all this stuff. And we don't want to create that kind of environment. We want positive oral health. We don't want parents who are now, still saying, I was traumatized by my dentist.
Right.
We want kids who grow up and they're like, oh, I love my dentist. It was like the best experience ever. So that's kind of what we're trying to aim for. And at that first visit, a lot of parents who come see me, I feel like the expectations also need to be adjusted, because we don't actually do that much in the child's mouth. I mean, we take a look, we assess for development, we check for cavities, and, we check for lip ties, there's all this stuff that we're looking at. But at the end of the day, the visit is mostly one to talk to the parents, to start to establish that relationship and trust with the child, which is huge. So it doesn't feel like much, because sometimes we don't even do a cleaning. Sometimes we don't even do any fluoride treatments. We're just looking at the teeth and kind of getting the baby comfortable to stranger in the mouth. It's different steps, parents brushing, stranger brushing. It's a whole different realm. So sometimes we don't even have the kids sit in the chair, we do it in the parent's lap. So I know sometimes parents want this and that done, but we also have to adjust our modification and approach. The purpose of them coming early is so we have the flexibility to make everything positive in the future.
Right. Well, and develop the relationship too, and work on that for the parents as much as for for the child. Is it still right? So every 6 months, or like, I know I went to the dentist recently and found out from my insurance that they'll pay for me to go every, once a quarter, every 4 months. And it was like, wow, when did that change? So what are the current recommendations?
Currently we're recommending every 6 months, but for kids that are at higher cavity risk level, I have kids who see me every 3 to 4 months. And then kids with behavioral challenges, I work with a lot of children with neurodevelopmental disorders, including autism spectrum disorders. So for those kids, I see them sometimes like every 2 weeks, every 1 month. And sometimes it's just about coming into the office, saying hi, getting a prize. And we are all trained to work with children with special needs, families with other special medical needs. And I know with COVID, it's a little challenging. You don't know if you can go somewhere and trust something, but I do encourage parents, dental offices are actually very, very clean. If I didn't feel safe and clean with my 20-month-old, I would probably strongly consider not working as much. But because I know the protocols in place are very safe at our offices and all my colleagues' offices in the Bay Area, I know that, we are able to give appropriate dental care, prevent cavities, and do all of that while still maintaining the COVID protocols. Definitely after the shelter in place, there's been a surge, at least in our patient population, of kids we've had to treat with cavities. They come back and it's just like a whole mouthful of stuff already, starting from the snacking, which I mean, I've been doing too. And there's just so many challenges that parents are navigating. So oral health is taking a lower priority. So I think that the best you can do for your child, if you're struggling at home to balance it all, just take them to see us, and we can help you. We can help you clean the teeth. We can help you monitor if there is something in the mouth, and we can help give some guidance.
Thank you so much for your time today. There are so many other things but I think, you know, as a parent, it depends on where you are in the moment with your child
Yeah.
and, you know, what you need. So, you know, we didn't even get into, you know, like looking at braces or, you know, any of
Yeah.
those kinds of things that can be for another time. But I know we will